Now we come to the dynamo of this workshop, Professor Amina Hassab. She's going to talk to us about the external laboratory assessment, the guidelines, and application.
Thank you, Dr. Mon. Actually, the whole story of this workshop is about alternatives for proficiency testing and internal QC, not replacements, but alternatives and additions. So I'll be talking about an alternative assessment procedure. What the objective is to explain what it is, define it, and say how to perform it, and what are the guidelines. And also define the external quality assessment methods, and when to use these alternative procedures, and what are their guidelines, and what is the specific assessment procedural methods. As I said, the alternative assessment procedure is an alternative assessment that may be incorporated in our quality management and our proficiency testing protocol. And quality, all the quality assessment plans of the lab. It acts as an additional monitor of ongoing patient accuracy. Additional. External quality assessment. The external quality assessment is used to describe a method that allows for comparison of your laboratory's testing to a source outside this lab. Usually, in many occasions, the EQA is used interchangeably with proficiency testing. But actually, it covers more than proficiency testing. And it is defined as a system for objectively checking the laboratory's performance using an external agency or facility. What are these types of external quality assessment? As we said, proficiency is one of them. Rechecking or retesting, on-site evaluation in your same lab, or an exchange of samples with another lab. And of course, you always have to, when you do inter-laboratory comparison, you have to choose a lab that is accredited, CLIA or any kind of accreditation standard. Proficiency testing, you all know what it is. Rechecking or retesting is like when you want to recheck slides that have been read by one operator or one specialist, and you are checking it by another specialist reading these slides, or repeating the test by a different operator. On-site is usually done when it is difficult to conduct proficiency testing. Not every test you can have proficiency testing for, and this is where you need to use on-site evaluation or the other methods of inter-laboratory comparison. So when do you use these AAPs? When the commercial proficiency testing is not available. Either it's not available from the beginning, or for some reason it is not present in the country where you're working, and it's not available. Like we passed through this experience a few months ago. There was a problem with the proficiency testing. So during this period, we should have changed our policy into the AAPs. As you all know, the CLIA classifies tests into waved, non-waved. They classify them according to the complexity. They also classify analytes into two groups, regulated analytes and non-regulated analytes. For regulated analytes, proficiency testing is mandatory. For unregulated analytes, proficiency testing may not be available, and in this case, you may need to use the AAP methods. I'll give you an example of the list of regulated analytes is much shorter than the unregulated. The unregulated, I couldn't put an example because it's several pages, several tables. For example, in hematology, this is the scope of regulated analytes, which means that factor measurement, the coagulation factors, and so many tests in hematology are not included in the regulated list. So if you're going to do the alternative assessment procedure, you have to follow some steps. First, you have to incorporate it into your proficiency testing plan and your quality assurance program. They are not there to replace proficiency testing if it's available, but it may serve as a primary proficiency method for non-proficiency testing regulated analytes. Or you can do it together with, for the regulated analytes or any analyte that you have proficiency testing for, you can add this as a secondary, as a backup for it. So the lab will first define which analytes they would like to have an alternative assessment process for, and you have to document the procedure in your manual and define the frequency of performance of these alternative test assessments. In many cases, twice a year is quite enough, but it's up to the lab, but at least twice. Second point, the lab has to define the limits of acceptability of each quantitative assessment procedure in advance prior to running this procedure of alternative assessment. You can do this through you develop your limits of acceptability from your internal quality control charts, plus or minus 2 or 3 standard deviations as you define them, provided that you have sufficient quality control data. You have a long period of quality control data, and here you define your cutoff values to accept or not accept the results that you will get in the alternative assessment. Of course, you should use samples. You will use patient samples in your alternative assessment. You have to choose the samples that cover your analytical range, not only of in the normal range or very high or low. All your work has to be documented, and when you have any violation or unaccepted alternative assessment, then you have to look for the corrective action and document it. What are the advantages of doing these alternative assessment to proficiency testing? First of all, you'll be using patient samples, not quality control material, well, a proficiency testing, and so here you have the same metrics as your, there is no discrepancy between your running samples and the ones that you are testing. And they are totally independent from the routine QC. You have to keep running your internal QC as you're doing all the time. Of course, these in-house AAPs are more timely than does the proficiency testing program. This kind of assessment also assesses the pre-analytical phase of the testing versus the proficiency testing that does not evaluate your pre-analytical phase. Now here you have your patient samples, you know when they were collected, in which tubes, the transportation, you can evaluate every little thing about the pre-analytic phase so that you can detect any error. Okay, how are we going to do this alternative assessment? I will say that I have test A and I want to compare my results with another lab. I want to do an interlaboratory comparison. First, I have to choose the lab that is accredited for this test. Second, we have to realize, we have to think, are we running the test on the same type of instrument and the same method and same reagent, or there's a difference? If we're carrying the test or performing the test on identical analyzer, same method and same reagent, then I do not need to look for a bias between the results of my analyzer as opposed to the other lab's analyzer. Okay? But if this referral lab that I'm going to send samples for does not have the same analyzer or has a different method or reagent, then we have to calculate the bias that happens between the results run by both analyzers. Of course, there will be a bias because of the difference in the engineering of each analyzer and between the different methods and reagents. So of course, the ideal situation is that when we do a comparison, we do comparison with an identical instrument, just as we do in the proficiency testing when we enter with our peer groups in the same method, same analyzer, and same reagent. As I said, if there is any different, then I have to calculate the bias. How are we going to calculate the bias between both labs? We will take a number of specimens, get the results on using for lab A, on the instrument of lab A. We have a number of specimens. We run them on the analyzer. We get the mean of the results of the 10 samples. And then these samples are sent to lab B. They are run on the other analyzer, which is different from the first one. The other lab will calculate the mean of the 10 samples. And then we'll get the average mean of both groups. And the bias factor is calculated by subtracting A minus B, and the difference is called the bias factor. Okay? So if I send other samples to lab B to compare the results, I have to respect the bias factor, which means, for example, in this condition, the results in lab B are lower than those in lab A by 6.3. This is my bias factor. So I take this into consideration in comparing my results. Okay, if I want to do this alternative assessment to unregulated analytes, I have to realize a few things. We will do the split sample and send to the other lab, and the difference between the readings between lab A and B should not exceed 15% difference between the two machines after correcting for the bias factor. And I have to realize I will not send one sample only. I have to send a group of samples to be analyzed in lab B, and at least 80% of the score for the group should be accepted. Yani I cannot accept if there is a difference more than 20%. So after I do my comparison with the referral lab that I choose, we have to document our data and have to keep the records for 2 years. Actually, all I'm talking about is the CLIA regulation for alternative assessment and CAP regulation. So we have to record the date where we did this assessment and the results of the in-house, and also keep the printout of the analyzers. Any corrective actions, of course, must be documented and have to be investigated and documented. Now, for specific assessment procedures, we can use external split sample analysis or internal split sample or audit sample procedure. And there are 6 ways. The external split sample, internal split sample, audit sample procedure, direct observation of the technique, and re-evaluation and analysis of inter-laboratory control data. For the sake of time, I'll have to go a little bit quick. Let's go to the number of samples that we must run. If I send 3 samples to be compared between my lab and the referral lab, I must get 2 correct ones out of the 3. If I get more, then I have to repeat. I have to use 5 samples or 6 samples, and I have limitations. See, if 3 is the recommended minimum number, if only 2 of the 3 match, then the sample size should be increased to 6 samples to be compared with the other lab. 5 of the 6 must match, they must match each other. If the mismatching is more, then I have a problem and we have to investigate this problem. This is an important notification. Of course, there is more than one way to interchange samples, as we all know, like with a group of labs, we look at, we see our internal QC like the Unity and so on. There is another way when there is a test that does not have proficiency testing, like a lot of the new complex testing, then a CAP can arrange the collection of samples, like for example, like immunohistochemistry and for hematology and so on. The CAP can collect the samples and send them to a group of labs and send the results to each lab anonymously and together with the result of the lab. This is one way of comparing results with different labs. So the take-home message, there is a procedure for the alternative process assessment. Determine the analytes, determine the procedure, the number of tests, establish evaluation criteria, and then perform at least semi-annually, define the samples that you will send, and cover the analytical range, use patient samples, document, evaluate for trends, and do corrective actions, and review. The director should review all this data. And thank you.
Thank you very much, Professor Amina. It's a wonderful talk and a wonderful presentation, and it is touching something that we're suffering from recently, the delivery of the quality of the proficiency testing material is very delayed from the companies, and this is a very successful alternative.
شكرا دكتورة أمينة.
أيوة محمد.
أنا بتكلم على الأون سايت ايفالويشن، one of the alternatives إن تعملوا أون سايت ايفالويشن. هل ده يعتبر internal quality ولا external quality؟ يا ريت تدينا شوية.
On site, you mean in the same lab?
Oh, in the same lab.
You can, of course, you can evaluate. If the procedure depends on the operator, then you can compare the performance of different operators. So, if you did the test in my lab and I want to evaluate your work, I'll give it to someone else and compare the results.
بس ده يعتبر internal quality management.
أنت سألت على internal.
ما يعتبرش external.
Inside the lab without comparing with someone else. Or if it is something like interpretation of electrophoresis, interpretation of a smear or a reading, you can have another operator read it.
شكرا.
اوكي.
دكتورة أمينة سؤال لو سمحتي. يعني أنا لو متوفر.
انتوا متفقين؟
ما فيش حد غير.
طيب
ادم ما فيش، يعني طول ما انا عندي البي تي متوفر، البروفيشنال تيست متوفر، ما بستخدمش الاي بي بي.
لا انت حر. But you cannot replace, but you can add to the proficiency. انت بتبص على الورك بتاعك بكذا طريقه، internal QC و proficiency testing, and you can also add the AAP.
ما هي الاجابه دي اللي هتوقف عليها السؤال بقى. طب افرض انا لقيت البي تي بتاعي كويس والاي بي بي ده مش كويس.
مش كويس بقى، ده هتشوف بقى هو المعمل الثاني كويس مضمون ولا انت اللي عندك مشكله.
المفروض ده ريفرنس لاب زي ما حضرتك قلتي.
ما هو الريفرنس لاب ممكن يكون لاب
دكتور محمد
المهم يبقى اكريديتد. ما هو هتنقي، لازم تنقي اللاب.
اوكي.
ما انت ما تقدرش تقارن روحك بحد انت مش ضامن شغله عامل ازاي، لازم يبقى اكريديتد.
اوكي ثانكس.
انا بس عايزه اقول حاجه، ان احنا كنا عايزين نخلي الدسكشن تبقى ساعه الاكسرسايز. ممكن كلكم بليز احتفظوا باسئلتكم، يعني اتس فيري امبورتنت ان احنا تو هير. Okay.